And here is your question. Okay, so if you have read and understood,
Yes,
consultant
ma'am.
with communication skills station, kindly begin.
Hello, I'm Dr. Mithila, one of the surgical doctor. May I confirm your name and age, please?
Yes, I'm Peter. I'm 55-year-old.
Nice to meet you, Peter. Today,
Okay.
I have been asked to talk to you about an investigation we would like to arrange for you. But at first, could you please tell me what do you know so far about this?
I don't know. I heard that you are going to insert some tube through my
Mm-hmm.
mouth and going to look for something inside my tummy. So I don't really
Okay,
know much about it.
okay. Let me explain it for you. Let
Yes,
me
please.
draw this whole procedure for you. It will be easier to you. So this test is called Oesophago-Gastro-Duodenoscopy. The short form is OGD, in which there will
Okay.
be a coin-shaped tube-like structure, which is called endoscope. There will be a camera fixed in front of it. It will pass through your mouth down to the food pipe, up to your stomach and upper part of the small bowel. The picture will relay on a TV, so we can see directly what's going on inside your food pipe and stomach. As you know, you have done a special X-ray before, which shows that there might be a narrowing of lower part of your food pipe. So during the procedure, we can see what's going on there. We can dilate that narrowest part, and we can take some samples from the lining of your food pipe, and we will send this sample to the pathology department to study, to confirm your diagnosis. This whole procedure will be under sedation. You will feel no pain. And do you understand what
Okay.
I have said?
Yes, but can you tell me if it is going to be risky because you are going to insert such a big thing through my mouth? So is it
It's a
risky?
simple test. It's not that big thing. It's this coin-like diameter, and it is a tube-like structure. But unfortunately, every test has some risk factor. So, like if you lose teeth, you can damage your teeth. There might be some kind of chest infection or a little bit of bleeding from the sample taking site. There is a rare but major complication can occur, that is the cut through your food pipe, which may need surgical intervention to repair. But you don't need to worry. This is a very rare complication, and
But
only skilled surgeons are doing this investigation here. So you don't need
no,
to
but
worry
I don't.
about it.
No. I don't think I want to perform because there are so many risks. What if I have any one of them? I don't want to do it.
It's my duty to explain the risk for you, but it's not necessary that it will essentially happen. And this is a very safe procedure. Our doctors are doing it on the daily basis. There are very simple and rare complication. And in your situation, unfortunately, we have to do this test to confirm your diagnosis and to treat your situation. And you don't worry about the complication. It's just a simple daycare procedure. You can go back to home in that day. And the
Okay,
complications
doctor.
are very rare.
Okay, doctor, you are saying that I have to do this to get out of know my situation. So do you think I
Yes.
have cancer in my tummy or in my throat anywhere? Do you think
Uh,
it is cancer?
we can say it in this moment. We have to wait for the report. Usually it comes within 2 weeks. I will let you know as soon as it arrives.
Okay, and do I need to stay in the hospital while doing the after that?
No, no, it is a daycare procedure. You can go back to your home, but you have to bring someone with you because we will give you some sedatives and we will feel drowsy. So you need someone to drive you back to your home. Is that okay for
Okay.
you?
Yes, yes, that's all right. But have you seen my previous investigations? Do you know if there is any abnormality or not?
There is a investigation that is a special X-ray was done for you, which showing the
Okay,
narrowing in your lower part of foot pipe. That's why we are planning to do the OGD.
okay, doctor. Okay, then I will do the test.
Okay. Okay, thank you.
But
But
Doctor,
let
can you
me,
tell me, yes, why do I keep on salivating all the time?
why do I keep
okay.
on salivating all the time, doctor?
From your previous investigation report, there is a narrowing in your lower part of foot pipe that hampers your regular secretion to flow downwards, and it came back through your mouth, and you are salivating. We are hoping by doing dilatation, we can improve your this situation. So hope for the best.
Okay, doctor, I have one more question. Do you think
Yes, please.
can I drink or eat before the procedure?
Yeah, you have to maintain something. I'm just going to tell you that you have
Okay,
to avoid any food or any kind of drink, say, minimum 6 hours before your procedure. And after 4 hours, you can drink some liquid food, but you have to avoid hot beverage. Do you mind if I ask you some personal question?
no, please go ahead.
Do you smoke or drink alcohol?
No, I don't. Yes, I do.
Okay. Sorry, I'm afraid you have to avoid this during this procedure.
Okay. And what about my other medications that I use?
Do you
Can I have
take
them?
any regular medication?
Yes. So
Like,
I
can you
take
tell me the name of the
antihypertensive.
drug?
Oh,
You
I
can
don't
continue
remember the
your antihypertensive. Any other drugs
With a
you can
sip of water. With a sip of water.
only a sip of water.
Okay.
okay.
Do you
Okay.
take any other drugs?
No, no,
Medications.
no other drug.
Okay.
No other
Okay,
medications.
sorry. Okay, so let me summarize this conversation for you.
Yes, please.
So we are planning to do a OGD for you for your dilatation and for taking a sample. I have explained all the complication to you. You are aware of that, and I have told you what to do and what not to do before and after the procedure, and told you about your um, attendance. Do you understand the whole thing?
Yes.
So can you
Thank
repeat
you.
what I have said?
No, no, no,
Mm,
repeat. Then if you agree,
okay.
then can you sign the
Can you
consent
sign the
form?
consent form for me?
Yes, of course.
Okay, thank
Thank
you
you.
so much. I will leave my contact number with the nurse. And please feel free to contact me whenever you want to
Okay,
contact.
doctor, I have
I'm
a
always
question.
there.
Why did you say that I should bring someone to take me home?
Because after
Can't I go on train myself?
actually after the procedure you will be drowsy, so it
Yes,
will be
but
better if
I will
someone
not be driving. I will be traveling on train, city train,
train.
metro.
Yeah, you can drive. You can go back to home in by train, but it will be safe to have someone with you because you will be drowsy, and during walking and catching the train, it will be easier for you to have someone
So
with you.
if this question was asked in exam last time, and your answer should be no, you will not recommend that patient should travel home on train, because it could be a rush
Why?
hours, and there could be
Okay, okay.
yes, patient can faint after procedure, anything can happen. And in order to
Okay.
be safe, you will still advise that patient should ask someone to take and drop.
Take him or her
Yeah.
home.
Yeah, instead of either call the taxi or go by someone, instead of going on his or her own on train. So your answer should be no, you won't recommend
Okay.
And ma'am,
traveling
If
I
on
he
have
the
one
can
train.
more
go
question.
and travel through the taxi, can he go alone, or he has
No,
to?
no, that then patient can, because if patient arranges or I ask for taxi, then you can say okay.
Taxi. Okay.
I'll make sure nurses they arrange it for you.
Okay.
Yeah.
Okay.
Because on taxi, a patient can be dropped off right in front of the home, but cannot travel on train because of the rush hour. Anything can happen. Patient can have sudden low vasovagal shock, or anything can happen. Who will take the risk
Okay.
of
Yes, sir.
patient? So you'll
Okay.
not recommend. You'll say you'll not recommend. And consultation, you'll end the consultation by asking the patient to sign the consent form. That's what you are doing.
Yes.
The whole purpose of counseling for OGD is to take the consent, right?
Consent. Yes.
Yeah, good.
Okay.
Yes.